What does a CEA tumor marker test reveal? Have you ever wondered what a CEA tumor marker test can tell us about colon health? The CEA test, which stands for carcinoembryonic antigen, measures the level of a specific protein in the blood. This protein is usually produced during fetal development and is found at very low levels in healthy adults. When CEA levels are elevated, it can indicate the presence of colorectal cancer, which includes both colon and rectal cancer. The CEA test serves several important purposes. First, it can help detect and monitor colorectal cancer. While high CEA levels may suggest cancer, it is important to note that this test is not used as a general screening tool. This is because elevated CEA levels can also occur in other conditions and types of cancer. Another key use of the CEA test is to assess prognosis and staging. Generally, higher CEA levels are associated with more advanced disease. For instance, if CEA levels exceed 20 nanograms per milliliter, it may suggest that the cancer has spread to other parts of the body. The CEA test can also guide treatment decisions. In patients with stage Roman II colon cancer, elevated CEA levels before treatment may indicate a higher risk of cancer recurrence. This information can help doctors decide if additional chemotherapy after surgery is necessary. Furthermore, the CEA test is useful for monitoring treatment effectiveness and detecting recurrence. By measuring CEA levels before, during, and after treatment, healthcare providers can track how well the therapy is working. After a tumor is removed, CEA levels should return to normal within 1 to 4 months. If levels begin to rise again, it may signal that the cancer has returned. However, it is essential to understand the limitations of the CEA test. Elevated CEA levels are not exclusive to colon cancer. They can also be increased in other cancers, such as breast, lung, thyroid, and pancreatic cancers. Additionally, some benign conditions like liver disease or inflammatory bowel disease can raise CEA levels. Even smoking can lead to higher levels without the presence of cancer. Not all colorectal cancers produce elevated CEA levels. In fact, over 10% of patients with colorectal cancer may have normal CEA levels despite having the disease. Moreover, CEA levels alone do not provide a precise prediction of tumor size or stage, so results must be interpreted alongside other clinical findings. In summary, the CEA tumor marker test reveals whether there is an elevated level of carcinoembryonic antigen in the blood. This can indicate the presence, progression, or recurrence of colon cancer. While it is a valuable tool for monitoring the disease, it is not definitive on its own. It should be used alongside other diagnostic procedures, such as colonoscopy and biopsy. Regular CEA testing can help guide treatment and follow-up care for patients with colon cancer, ultimately supporting better management of the disease. Always consult with a healthcare professional for personalized medical advice.